Thumbs up, you guys can hear me, correct? Awesome. Okay, so let's get started. We've got a great panel discussion for you all tonight, tuning in from home. I appreciate you guys tuning in. My name is Adam Shimoni, and I'm hosting this webinar for all of you at home on behalf of Flagstaff Resources, which is a great resource website guide. And we thought it'd be a good idea to bring everybody together and a lot of folks in our community together who work around wellness and mental health. And we have members from Northern Arizona Health, we have Health Choice, we have members from Terros, NACA, and the Guidance Center with us tonight, tuning in. And we're really grateful for all of you. So thank you, all of you, for joining us tonight. Appreciate you joining us for our first panel discussion with the public. It means a lot to me and our viewers. What we're gonna do is just kind of have folks kind of go agency by agency and give you all an update to the public and let you all know about some of the services and programs they offer, and especially focus on things that are very relevant today and the needs of the community today. So with that, let's turn it over to Northern Arizona Healthcare to start us off.
Hi, I'm Todd Parker. I'm one of the managers at Flagstaff Medical Center Behavioral Health, Northern Arizona Healthcare. We're trying to operate mostly business as usual. We still have our adult unit. We've reduced it down to single occupancy rooms for COVID response to that. We have 9 total beds on the adult side. Our adolescent unit is still currently under construction, which is paused until we get that back up and running. But as far as providing services across the organization, we still continue to provide consultations both in the emergency room and on the floors for behavioral health emergencies. We're doing this by Zoom capabilities whenever possible, or by phone, depending on what the needs are of the community. Our outpatient clinic, again, is business as usual. We've moved over to Zoom capabilities. Some choose to still want to use telephonic conversations, but we're doing individual sessions in our outpatient clinic, psychiatry visits, and our recovery court contract, we're doing Zoom meetings for those clients also in the evenings. And that seems to be going well. Keeps everyone safe, keeps them at home. We're doing the Zoom capability. We're also offering BH urgent support for the frontline staff, anyone working with it within Northern Arizona Healthcare. They can call our intake, assessment, and referral line, and we'll get them coordinated with a counselor, an appointment, or even EAP services if that's what's needed in the moment.
Thank you,
That's
Todd.
great, Todd. Thank you so much for giving us that update. And Kim, I'll let you just continue where Todd left off.
Yeah, I was just going to say, I'm Kim Alexander, the Director of Behavioral Health, and we are certainly trying to kind of keep business as usual, with the exception that, Todd mentioned. We are seeing an increase in our inpatient unit with folks coming in that are struggling directly related to concerns regarding the COVID pandemic. So kind of working with that, but certainly doing the best that we can, as I'm sure all the agencies are. It's a whole new world for all of us.
Absolutely. And thank you, Kim and Todd, for your service. Do you all mind if we just maybe dive into a scenario? A lot of folks at home might be, there's a stigma about going to receive support today and going to seek a medical doctor and go through that whole system. Can you just walk through that scenario for someone in the public who might be intimidated about, their own of coming in, or they're a risk of potentially spreading something that they might have or contracting it themselves?
So I can speak to that. If they're looking for outpatient services, certainly calling our outpatient clinic number, speaking with one of the office coordinators and getting something set up. They wouldn't have to come into the office. We would do things via email and set up a Zoom meeting, audiovisual or telephonic, if they don't have the Zoom capability. With regard to urgent appointments, those patients are still coming in through the emergency department, but in a different area, as far away as they can from those that are rule out COVIDs or even COVID positive, and standard protocol PPE is put on at that point. And then we do those assessments via Zoom technology down in the ED with our staff up on behavioral health. So to get into BH, that is still the urgent process, we're seeing somewhat of a decline. I think people are staying at home and not coming in and utilizing that, which is why we wanted to offer the outpatient resources as a less urgent method if people want to call in and do that. Certainly, as Kim said, we've seen a lot of patients coming in or in our clinics or in inpatient are just struggling with being in their homes during this time, lots of stress, maybe not working as much or at all in a lot of cases financially. So the stress level is up, arguments within the home. And if there's someone positive in the home and they're not, it's a very stressful time. And so outpatient would be a good means, or otherwise, if there's an urgent situation, then we would have them go through the ED with exercising all those precautions, but only if it was truly an emergency, given all the COVID precautions.
Great, thank you, Todd. Kimberly, Todd, anything you'd like to say in closing for now, or should we carry on?
I think we can carry on.
Yep.
All right, let's do it. Brianna and Ryan are with us from Health Choice, and I'll let you all just take it away.
Good afternoon, everybody. My name is Ryan Cappella. I'm the Director of Adult and Crisis Services at Health Choice Arizona. And first, I want to thank all of the providers that are on this call, because they are really the ones that do all of the amazing work and help all of the people who are suffering and their families out there. So most importantly, I want to say thank you to all you folks. I thought I would just explain a little bit about what Health Choice does, and then I will pass it off to Bree. Health Choice is an access complete care health plan, which means that we're a health insurance company like Blue Cross or an Aetna for people who are on access, or for people who aren't from Arizona watching this, which is it's Arizona's Medicaid program. So as a health plan, we maintain a physical and behavioral health care network. We establish contracts, assure quality and utilization. And mostly what we do is try and support, or at least in my team, what we try and do is support the providers in the community who are actually doing the service, like FMC, NACA, TGC, and Terros, and many others in our community in Coconino County, in Arizona as a state, and everywhere that we can. Personally, I oversee the adult behavioral health and substance use services, opioid initiatives, and crisis services. And that's where Bree comes in. So I'll pass it off to Bree, who's the crisis services coordinator for Health Choice.
Thanks, Ryan. So as he mentioned, my name is Bree Barrios. I'm the Crisis Services and Disaster Response Coordinator at Health Choice. And there's two things I'd like to highlight today, one being crisis services and the other being disaster response. So as Health Choice is the regional behavioral health authority and a health plan, we offer a behavioral health crisis system to Northern Arizona. Now that system is accessible through a 24/7 free of charge crisis hotline. And that crisis hotline number is going to be 1-877-756-4090. And so any individual is able to call into that crisis line regardless of insurance and speak to a crisis specialist within seconds. And that crisis specialist is trained to work with that individual to address their needs and get them connected with resources. And if for some reason the situation can't be resolved on the phone, that specialist will work with our local providers to get them connected with additional care, which may include dispatch of a mobile crisis team, and I'll leave that for Terros to explain, or assistance with getting into long-term care or some sort of higher level of care at one of our health homes, like the Guidance Center. Now, part of my role is to ensure that the system functions continuously. And so that's where our disaster response and emergency preparedness comes in. So in events like a forest fire, flooding, or like the event we're in now with a global pandemic, we'll work with our local providers and community partners and law enforcement on our tribal nations, with public health departments, et cetera, to ensure that the community is getting the services that they need. And with that, I'd just like to note that even during this pandemic, our crisis system is still fully functioning. And we've actually found new and improved ways to deliver services should that be necessary. And so I want to continue to encourage you to access those behavioral health through the hotline.
Sorry, Bree.
No, you're good.
Thank you. That is great. Really appreciate you and your efforts, and Ron, you too. Thank you so much for all that you do. And yes, I appreciate your opening sentiment. You know, we couldn't do this without all of you and everyone else, all the other agencies, but we really have an amazing umbrella of agencies in our community that are here to support you, the individuals in our community, and all of us really. And it's really incredible. And personally, I didn't really know about all the agencies that are out there like all of you do. But as soon as I've been, more involved myself, I've been very pleasantly surprised and excited to learn about all the different efforts happening in Flagstaff, and really all the collaboration and synergy that all of you have with each other. And I know it's not perfect, but I think that we are doing some incredible stuff collectively, and there's some really good group efforts happening. And just all of your willingness just to get on a panel like this together, it just shows that we are very much all in this together as one community, and it helps us achieve our goals that much more. So thank you all for that. Brian from Terros, hit it.
All right, thanks, Adam. Thanks to everyone who's calling in right now. My name is Brian Guest. I'm the Director of Northern Arizona Crisis Services for Terros Health. So we're a nonprofit behavioral health organization, and we provide to Flagstaff and surrounding areas what's called mobile crisis services. So as Brianna spoke to just a minute ago, we're part of the statewide crisis system. So when an individual calls the crisis line that Bree mentioned, which is the 1-877-756-4090, it's the Northern Arizona-wide behavioral health crisis line. And that number also is listed on Terros's website, Health Choice's website, I think the Guidance Center's website, and I think the websites of pretty much all the agencies in here. So it's hopefully an easy number to come by. But individuals can call that number 24/7, and they are given support over the phone by an organization called Crisis Response Network. So Crisis Response Network will provide support, ask some questions also to see what the person is experiencing, what the severity of maybe some of the things they're experiencing are. And one of the things about that hotline that I want to emphasize too is we call it a behavioral health crisis line, and I think for some it's not clear what does that even mean. What is a behavioral health crisis? Maybe I'm feeling pretty bad right now, but I don't know if this is a crisis, so I don't know if I should call. That phone number, again, is open 24/7 to anybody, and there's no severity level that someone has to be at to call that number. So anyone who's just not feeling good and wants to talk to somebody can call that number anytime. It's completely free of charge. When somebody calls that crisis line, if it's determined that the situation is something that would be better addressed in person, the crisis line will then dispatch us, Terros Health, to provide a mobile crisis response. So what this looks like is some of our staff, either one or two staff, depending on the situation, coming to wherever you're at, whether it's at your house, which is the case most of the time right now, but we also, in normal times, go to schools, the hospital, and pretty much anywhere where somebody is at and having a hard time. So we'll come and we'll work with you to sort of get an idea of what's going on. We'll also ask some questions to assess if somebody is potentially a danger to themselves or others in that moment, maybe experiencing suicidal thoughts. That's pretty serious. So we'll assess for those kinds of things as well. But really, we want to work with people to just provide that support in person, as well as to have a outside third party can maybe see things that people can't always see for themselves in the moment, especially when emotions are running high. So will help people look at, what coping skills they already have, and help make a plan for how to sort of engage those coping skills. We can also teach people, some new skills, or just get them thinking about things that they weren't thinking about before, help identify maybe negative thinking patterns that people are stuck in, and helping get unstuck from that. And then helping create a plan for the immediate future, the next 24 to 48 hours. What are some things that you're going to do to make sure that you are taking care of yourself, addressing, whatever the issues were that we came to see you for. And then after we've seen someone for that initial encounter, we'll also then follow up either in person or by phone in the next couple of days to make sure that they're still doing all right. Also make sure that they've kind of followed through with some of the plans that we created with them, and also connecting them to ongoing resources, so agencies and things that can provide ongoing mental health services, physical health services, as well as other resources that person might be in need of, whether that's food, eviction protection, all sorts of things.
Brian, thank you for that. And if I can follow up with you and just ask, can you go through a couple scenarios as to what you're seeing? Obviously every case is different and every individual is different, but what are some of those lifestyle practices that you're teaching folks? Maybe just walk through a couple basic ones that cross a large spectrum of people.
Sure, yeah. And in these kind of COVID times, interestingly enough, we had initially seen actually a decrease in the amount of times we were being dispatched to go see someone, which was a little bit puzzling and troubling, maybe, thinking that, these are uncertain times and people have got to be experiencing stress and more emotions than usual. And so, kind of concerning that maybe people aren't feeling like they can reach out for help, or maybe they're not aware. So that's, part of why I'm so glad to be on this right now, is to get awareness out there that these services are available and they're free of charge, and 24 hours a day, 7 days a week. So we definitely, although the amount of times we're being dispatched has been down a little, it's starting to come back up, and we are seeing, it's the COVID pandemic is definitely on the top of people's minds, and it's often a contributing reason why we're going to see people. And so I think that the range of things we see are probably, things that listeners right now are all experiencing to one extent or another. Loss of money, loss of income from being out of work at the moment, having to balance maybe working from home with also taking care of and sort of homeschooling the kids right now. Even just, as much as it's nice to be with the people that we live with, it can also cause more tension when we're sort of more stuck at home as it were right now. And then on the other end, people who maybe don't live with others, having that social isolation, they're no longer, able to see their friends in person, able to go out and do things that they would normally do. And so, that's just some of the things that we're seeing a lot. And one thing I like to say with the social isolation thing especially is it's sort of unfortunate, this term that became so common, the social distancing, that 6 foot or more distance we're supposed to keep from everybody, right? I kind of wish they had called that physical distancing, because I think it's really important. Nobody's saying we're not supposed to interact with each other, right? We just need to keep that physical distance. And so much of what we're trying to promote is how can people still feel that social connectedness, even though physically we're not supposed to be as near each other. So that's a lot of what we're doing, is empathizing with what people are going through, normalizing that it's completely normal to feel sad right now, to feel stressed right now. But what can we do to sort of see the positives in our situations and still have that social connection, even though we're more isolated physically right now.
Great. Thank you, Brian. That's very helpful. I don't know why the Zoom just started fixating on me versus you, but I appreciate those comments. And what I'm hearing, and I'm sure what the public is hearing, is that crisis is a whole range of topics, and it really depends on the individual, but it's big and small. And the word crisis can be very overwhelming and have some stigma to it. And it's hard to maybe recognize when you're in crisis. And so, these are challenging times, and it's human nature to be struggling, especially with, like you said, the social and the physical distancing, but it doesn't necessarily mean social distancing. We can still be connecting to the best of our ability. And those of us who have, the privilege to connect this way, through virtual technology, it's really a blessing. And these are hard times. So if you're someone at home struggling, definitely reach out and definitely engage with these services. Something I'd like to do for the folks watching from home is just show you something on my computer. And I actually want to show it to you this way. Okay, so basically, whoops, let me move this. So if you go to flagstaffresources.com, this is the website and the program that is hosting this panel today. And they are a great resource page for just everything and anything in Flagstaff regarding services to the public. And it's listed by program versus by agency. So it's very easy to navigate as the user looking for something you need to find. But something you can do is, you can type in crisis, like we're talking about. And if you click search, you'll find a lot of different support things here and a lot of different helplines and text lines and call lines that we're referencing, and you're hearing people on this panel reference. And so I invite everyone to take a look at this and kind of get a feel for what is available on this website. It's a great way to best utilize the resources in town. And there's all these great filters you can use to best identify what you want to focus on. But we did put together this COVID-19 filter. Definitely take a look at that. And if you're a member of the youth, we actually have a youth-focused program. It's called Online Teen Help. And it's got a lot of really good engaging programs here that when you hover over, there's options to chat, engage, reach out for support, really the whole 9 yards. There's different YouTube videos, there's inspirational speeches, there's yoga classes, there's things about wellness, nutrition. There's just a lot of information on this website, and definitely share this with your kids and your peers if you are a member of the youth. And it's even better through a phone. So take a look at that. You might be surprised by how this actually does support you and help you. Next, we have Terry from NACA. And Terry, thanks for being with us. And I'll let you just take it away.
Good evening, everybody. My name is Terry. I am a youth psychotherapist from NACA. I am currently serving under 2 departments, Native Connections, which aims to provide mental health services in reducing suicidal behavior, substance use among Native youth up to age 24. Also easing the impacts of substance use, mental challenges, trauma, and assisting youth as they transition into adulthood. Most of the population I currently work with is ages 8 to young adults. So that's kind of a general overview of what I do. A general overview of NACA, we are currently still seeing people through the Family Health Center. Dr. Hershey and Natalie Metz and his medical team are seeing clients over telemed services. Our behavioral health is currently in the process of getting intakes process started, which means taking in new clients. We're setting up virtually through Zoom. The hope is to start welcoming intakes by Wednesday, the 22nd. If you need more information about that, please call NACA front office, and I believe Adam has the number located in the his resource app. Let's see what else.
Terry, if you don't mind, I can jump in and kind of give you a question. Terry and I had a great conversation about all the great things that she is doing for NACA and for our community. And really, wow, thank you, Terry, for what you're doing. It's huge, and it's really a beautiful thing that you're doing. We had talked about coping methods to decrease anxiety amongst youth, and how youth are, maybe you can talk a little bit about what youth are going through today and some of these coping mechanisms that we talked about.
Sure. So a lot of our youth, or a lot of my clients actually have been experiencing a lot of anxiety, depression from the social isolation. But I like to call it the physical isolation, as Brian stated earlier. As far as engaging our clients in transitioning to Zoom, of course, just giving my clients a brief overview of the Zoom capabilities, exploring the different features of Zoom, and then, of course, informing them of the professional account in which that provides under confidentiality, and then of course going through like the ethics side of things, and of course getting parents' consent to Zoom. But as far as like coping mechanisms to anxiety, for instance, we've kind of just built on what they already have in place, but also if it's not working with them, coming up with new ways to deal with, if it's surrounding COVID-19, decreasing social media time, and then relying on credible resources such as like CDC. Easily the youth can be overwhelmed by social media and, looking up, seeing different information out there. But meditating, being mindful and also being present in the moment. And then also imagery. Those are some of the coping mechanisms that seem to be helping with the youth.
That's great. That's great. And I appreciate you sharing that with us. I really appreciate your holistic approach. And they have room for new intakes. So, and they're taking those intakes over Zoom, if I'm not mistaken. Is that correct, Terry?
Yes, correct. So like I was saying earlier, the only information that is needed for intake process is a good email, a good phone number, and of course Wi-Fi. And we hope to get that started by the 22nd. Additionally, the behavioral health is still conducting virtual groups for domestic violence, relapse prevention, early recovery, and DUI classes provided online resource Stonewall Institute. So essentially, we're still providing clients the full capacity to finish everything, which including hours from the court. And so last week we were conducting groups through Zoom. That was our first week doing that transition, and we graduated 3 individuals. So I think that's yeah. So just making sure that we're eliminating barriers that folks are out there having, and addressing those immediate needs. But if anybody needs any more information about the groups that we're providing, please contact Jonathan Yellowhair at 928-773-1245. His extension is 264. And additional to our services, we do have our Wellness Center, which is working diligently to support our clients, employees, and community by providing an online exercise program. The goal is to provide different content such as nutrition, different exercise videos, including yoga, strength training, different cardio workouts. So I believe I passed that information on to Adam. So if anybody's interested,
and we shared that on our social media pages. And I just wanted to chime in really quick, Terry, and say, you know, these devices that we use to engage and communicate and distract ourselves from reality at times can also be used to connect ourselves to reality and to our own realities and our personal well-being in our bodies and our minds and our souls. So I'm really excited to see that channel. It looks like you all have a bunch of great videos up there already. And yeah, keep going.
great. Yeah, I guess that's everything in a nutshell.
Wonderful. Thank you so much, Terry. That is great. And NACA offers, as she mentioned, just a huge range of great services and programs for our community. So if you're not familiar, visit their website, call them, check them out, and definitely check out their listings on the Flagstaff resources page. There's a whole bunch of listings on that page for you to scroll through, and it's a great service. So last but not least, we have the Guidance Center, and we have Trevor and Lauren coming to us live 6 feet apart with their masks on. I like the way you guys are rocking. I appreciate what you all are doing. I really appreciate what you do for our community. And it's incredible what you all are able to achieve, especially during this difficult time. But I'm grateful that you all are with us today, and I'd love for you to take the floor and tell us about what you all are up to.
Great. I'd be happy to. Thanks, Adam, for having us on here. Do you want to introduce yourself?
Sure. I'm Lauren. I'm the CEO of the Guidance Center here. And I'm going to defer to Trevor, but yet then I will kind of pick back up after Trevor shares.
And I'm Trevor Davis, the Chief Clinical Officer here at the Guidance Center and overseeing all of our clinical services. We're just glad to be here today. Thank you for inviting us. The Guidance Center has been around for a long time, but we seem to be ever changing and adding to all of what we can try and offer to our communities. So we have offices and sites in Flagstaff and Williams, and we serve adults and children and families. So basically the entire spectrum of ages we can provide services to. We have on-site 24/7 crisis services. So we have folks here to be able to assess. There are times when we work really closely with Terros and Brian's team, where they'll engage in the community, then they'll get to us, and we'll work with them as well. We have on-site crisis stabilization units, and we have a psychiatric hospital on site for adults as well. For engaging in services, I'll talk a little bit about what those look like here in a minute, but we're currently doing call-in or Zoom-in intakes, available 24/7. You can walk in and get your Zoom ID and go from there to a physically distant location and tune into Zoom or do things by phone, but we do prefer Zoom for at least the first hour of getting to know you in the intake. Right now we're offering about 90% of all of our appointments for psychiatric services, therapy services, even groups, and case management, vocational services, peer support, all via Zoom currently. So we're still doing some on-site services, particularly for the younger folks, that it's just tough to keep a 4-year-old engaged on Zoom. It's a little difficult. There's a beautiful shining screen and buttons to push, and it gets really exciting. So there are some folks that prefer doing on-site services, so we are doing some of that. But just for safety for everyone, we're trying to keep folks as much on Zoom as possible. As I said, we do groups, and we have anywhere from 20 to 30 different groups running at a time for all ages. Currently, we have a lot more of our groups on the adult side, things like anger management, substance use treatment for outpatient groups. We do mental health groups that are therapeutically based, but we also have peer support. So folks that have lived experience with mental health or substance use issues, facilitating groups for folks. Sometimes it just helps to leave behind the academic parts of it and the process parts of it and just talk to someone that has lived it. And so we would like to offer a little of both. We also have therapy-based music therapy, as well as 3 different classes of art therapy going currently. And we also offer peer support training that is certifying folks that want to become peer support specialists and join the workforce in our community for that. Folks with lived experience, but we give some training in communication skills and just sort of how systems work and all that, so that we can try and offer the best services. We hire folks out of those workshop groups, and we're proud to have them. We offer, for children, adolescents, and families, we offer a lot of school-based services, therapeutic support, parent coaching, and skills training, in addition to regular therapeutic modalities. We have residential services on site for addiction treatment. We have just expanded our program to make it a 28 to 90-day treatment program. It used to be pretty much rigid at a roughly 28-day program, but we have expanded a few of those beds to a 90-day program just because we knew that's what the community was needing, and we wanted to engage with folks more effectively to try and help them prevent relapse and prevent that cycle of having to return to the community, potentially having some legal involvement, having to potentially go on probation. And really it's just good service to offer more individualized treatment. And so that's what we wanted to do. Adam had asked me about some domestic violence offerings, and currently we work a lot with handling immediate safety concerns through victim witness and other community resources like Northland Family Hope Center to get initial resources on board, but then jump in with counseling and other intensive support thereafter. So we are part of that process, but we're not necessarily the first call with that. And then for support for the community, last week we started a support group for healthcare professionals. The coronavirus is causing a lot of difficulty for families. It's causing a lot of difficulty for companies, but for the folks that are on the front lines doing the heroic work of saving lives every day, we're finding more and more that sometimes folks are just waiting till it's too late to go to the hospital, and by the time they get there, it's just too difficult to help them. And so we're helping a lot of folks that way that are healthcare professionals to get some support and get through this difficult time. We're going to be starting in the next 3 weeks a building employment skills training. With unemployment rates going up and losses of jobs out there, we want to try and help provide some free workshops to the community for resume building, cover letters, interviewing skills to just kind of get polished up, as well as to kind of help with online job searches. It seems like anytime I've ever changed jobs, there's 16 new different programs that I have to figure out in order to kind of look for jobs. So that's, we want to try and help with that. We've also been offering mental health first aid trainings. We've currently got that on hold just because of in-person group requirements needing to be limited, but we will get back into providing those trainings soon. And as soon as we get approval for online options around that, we'll be trying to offer that as well. We're working on that with those folks. Really, as a result of what's been going on in this pandemic, we've seen a little of a decrease in crisis services and a little bit of a decrease in coming in for services initially, but with some outreach to folks, which we've intensified, we are now seeing extremely higher show up rates for appointments. So when you don't have the barriers of transportation, when you don't have the barrier of having to brave the weather to get to an appointment, or maybe 30 or 60-minute effort to get somewhere to get to an appointment that may be anywhere from 15 minutes to an hour long, having a Zoom option or a telephonic option with your therapist, your psychiatrist, your nurse practitioner, your case manager, your peer support, has made it so that a lot more folks are showing up for their services and getting the support that they're wanting and needing. So we're excited for that. And really, I just wanted to end with saying it's really critical at this time more than ever that we as community members are reaching out to each other, and that we are going after the folks that we may not have reached out to a lot lately. We may have lost a little bit of touch with, but you never know when a text message, a call, an email is going to really turn around depression, anxiety, or other things that are severely impacting people and potentially causing them to withdraw, be afraid at home, potentially alone. And so anything that we can do, we kind of have a rule that think about how often you probably should reach out and double it, and then go for it. We want to try and help. So that was about it. So that's it.
Lauren, would you like to add anything to that?
Yeah, I do want to add just a couple of things. One is talking about resources. We have learned sometimes, which Trevor talked about a little bit, people are resource challenged. And so we've come up with some creative mechanisms where, like Trevor was saying, with giving out the Zoom number, we've opened up our Wi-Fi to individuals. So they can sit in the parking lot, they can sit outside on the curb, they can, wherever. Or we do have individuals who at times, if they're coming in still in person, will sit at a larger table and have some social distancing that way. And I think Brian touched on this a little bit when we talked about social distancing. We are really starting to move towards social connectedness, so that people aren't losing that concept of, out of sight, out of mind, so that exactly what Trevor said, to kind of reiterate. But we're really trying to get creative with how we connect with people. So if people do have resource barriers, we want to hear about it. We've been able to issue some tablets out in the community to some of our communal living areas so that we can serve those individuals via tablet. They can connect via Zoom. That wasn't happening before. So we're very open to ideas, and we are very open to dispensing resources so that people are able to access the services. So we want to really barriers that may exist.
That's huge, Lauren, and thanks for sharing that. I think what you all have done to make your services accessible and reaching the public the way you are, through this difficult time has been really impressive. And, again, in recap, it takes about an hour to process the intake form to receive these services. And you could do it over Zoom or over a phone call or in person. And I mean, there's about 30 groups of that meet weekly over calls and engage on a whole range of topics, as you heard about, trauma to veteran supports to substance abuse to anger management. I mean, the list is long. And so this is a really good resource for the community that I, like many of you watching, are just learning about now. So definitely take the time to dive into these resources and don't wait to seek that support, and as Trevor mentioned, reach out to your friends and your family and your peers today. Don't wait, because that connection is missing right now from a lot of us, and is very appreciated today more than ever. I know in such a sensitive, time where people are not so willing to, just pick up the phone and call. We always want to text. We want to read our messages. We want to make sure that we're not putting ourselves in too much of a vulnerable place by just, putting ourselves out there. This is the time to put yourself out there and communicate, and don't wait for that text to make the phone call. Just actually pick up the phone and engage with each other today, and you'll feel better at the end of it. I personally didn't necessarily think it was so important to engage the way this panel is through a Zoom call and a conference call, and I started doing that with some friends, and I felt so much better about everything. And I know I have a lot of privilege, and I don't have half as many issues as some other folks might have in our community, but it really made me feel better, and I bet it will make you feel better too. With that, we're going to open it up to questions from the public. If you're watching from home, you're welcome to engage with the panel and ask a question for the group or an individual. We have a bunch of great agencies here on the line that are willing and able to help you in many ways. And there's no wrong question. So please do consider what you want to ask and write that in the comments to the live stream, which I'm monitoring. But until we do receive any questions, I'll turn it back inward to the panel and say, you know, now that you've heard each other's updates, is there anything that any of you would like to add, follow up with, et cetera, et cetera?
Adam, I'll jump right in.
Please.
And just add to what you said about, you know, now is the time to reach out. Right now, there's so many things that are closed, that are not accessible to us. All of these resources that we've just been talking about, which are extensive, the providers that are on here have gone through extraordinary efforts to make sure that they're all still open. So all of these resources are all available, even though you can't go to so many places and there's so many things that are closed. All of these things are open.
Absolutely. You know, I think you all have, like I mentioned, have done a great job to be available. And, you know, what I've realized is a lot of the community doesn't even know about half the things that are available today. And so that's kind of what we're all here trying to do, right? Is empower the community and educate with information and resources. Who else on the panel has something to share or a follow up? Feel free to jump in.
Yeah, this is Kim Alexander. And I was going to say, I think too, just recognizing, and for all of us to recognize and to kind of, you know, reiterate that it's a very stressful time. And I think the best thing that each of us can do is to not only take care of each other, but take care of ourselves and make sure that, you know, for those people that are not working and are out of a routine, to develop a routine. I think a schedule is critical in maintaining during a really chaotic time, and that we are able to focus on the things that we can control, because there's a lot that we can't. And then emotionally, again, really reiterating and encouraging people to stay emotionally connected. And I think those are some kind of, you know, basics that are really helpful for everyone.
Yes, thank you for that, Kim. I really appreciate those comments. And this is really the time to, you know, connect to yourself and take advantage of this opportunity to really explore your own passions and your own feelings and your own emotions and process those and do your best to grow. We do have a question, a couple of them. Joe writes, thanks for putting this together. First, I want to say that I really think that reaching out for help from mental health professionals is key. I'd also like to emphasize that most help is unfortunately not instant or even appropriate and is trial and error. What is being done to increase the number of good experiences in Flagstaff? Who wants to start? Go ahead and jump in, whoever wants to address that. I'll call on someone.
Well, I mean, I'll jump in just to kick it off, because I know that there's all kinds of things happening. You're absolutely right. Was it Joe, that every experience has to be sort of customized for each individual for what they need. You know, my hope that all the information that Adam's putting out on his website, all the things that the providers on here have talked about, that one of those things will work for somebody. Joe had asked specifically about Flagstaff, and I can tell you, meeting multiple times per week, most of the people on this call today are meeting multiple times a week to constantly assess what our capacity is to, you know, provide additional services to the community and to continue to provide what we already have. So whether that's, you know, you're having a medical emergency or behavioral health emergency, pretty much you can make contact with most of the agencies on this panel today, as well as all of the other ones that are available in the community. And for the most part, anybody on this panel here, if it's not right for you, at the time that you call, they'll connect you to, to whatever's going to work for you. If you call our crisis hotline number and you get connected with Brian and his team at Terros, they're going to help connect you to what is going to work for you. If you call the folks over at the Guidance Center, you heard that huge menu of items that the Guidance Center is still putting out there. The person you talk to is going to help you find something that's going to work for you, and not just, kind of put you into whatever they want to. They're going to customize, individualize services according to what you need.
Thank you for that, Ryan. I'll just add, just from what the Guidance Center is doing alone with their virtual calls, I mean, the ability to go virtual and do that well and successfully is, for one, a very big challenge in itself. But if you are able to do that and host groups and whatnot through virtual conferences, you can really reach a lot of people. So that really expands the ability to intake new people and put them into these groups. Although I can imagine you want to at some point cap the group in size to keep it intimate and appropriate. But do you want to touch upon that at all, folks at the Guidance Center?
Yeah, so I mean, we're happy to be able to do as much individualizing as we possibly can, and that's why we have an intake process at the very beginning, just to really get to know folks and what their needs are, what different services we offer that match up with what they're looking for. And what they're looking for in that moment may be different from what they're looking for the next day, the next week, the next month or year. And we are trying to do everything we can every day to adapt to the needs of the folks coming in here and getting services. And so we're doing a lot of listening and trying to really work hard at making things the best that they can be service-wise. One of the things with our Zoom groups that has been so interesting is, we've had folks just come in and say, I refuse to do Zoom. You cannot make me do Zoom. We're not going to make you do anything. But they come in anyway, and they've been on site necessarily. They're at home. And so then we're putting folks in rooms that they're still participating via Zoom groups, willingly, I will say, and they're still getting to engage with the folks in their groups. We took just a few days off getting the whole conversion to digital groups going, and when people came back together, it was amazing to see tears of joy from people being able to reconnect. It is such a stressful and difficult time that even a few days away from each other, when they're used to seeing each other at least twice a week, if not more, made a massive difference. And so it was really validating for all the folks working here to know that what we do is important and really critical for our community, but it really wouldn't be working if it weren't for the folks coming in here and telling us what they need.
I think also, if I could just touch base a little bit on the comment around trial and error. And sometimes, to be candid, we do hear that about medications when people are initiating medication. It's a scary situation. And so what we're looking for when people come in for services is for them to share and be honest about what is going on. Because right now is a perfect time. Potential job loss, homelessness, turmoil at home. Sometimes people are shy, embarrassed, disgraced. They don't necessarily want to share those things. And so I think that's sometimes where the trial and error piece comes in, because we don't always have the full picture. And so as much as people feel comfortable, which for us, developing rapport is a huge thing, developing that relationship. So as quickly as we can do that and people feel comfortable and are able to share and be honest, the chances of that kind of trial and error that you were referring to decreases.
Absolutely. Thank you for sharing that, Lauren. And going back to your comment, Trevor, about, how folks, when they're being disconnected from each other, even for a couple days, that reunion being so emotional and powerful because of how much they've realized that they miss that other person and appreciate the other person really, and really love the other person. I don't want to say that this is a blessing in disguise because of how terrible this is, this whole virus and all the lives lost and all those being impacted negatively by this today, and how, we're supposed to see the peak in 2 to 3 weeks from now here in Arizona. So we're not even yet, through the eye of the storm. And no one seems to really fully understand exactly what it is that's going to be hitting us in the coming weeks. But I think that what I'm taking away from the experience so far is, for one, all the different, lacks of our society to be a safety net for those who are most vulnerable. Although I like to say we're doing a great job with all of your agency, there are still people falling through the cracks today. And it's just a reality that we need to face and work to overcome and continue to work to overcome. But it's also an opportunity to kind of reset and take a step back and look at, what are we doing? How are we living? How are we, living in harmony with the earth and with each other? And how are we not? And where do we have areas where we can grow upon and enhance our relationship to each other, to ourselves, to earth, and live more in harmony and balance, right? So I think that this is a good little wake-up call to an extent to that focus. I do have another question, unless someone from the panel wants to jump in. And I'll read the question. And the question is, can people speak to the COVID precautions agencies are taking, particularly for crisis services?
Adam, I can start us off on that. So for anyone calling into the crisis line, after speaking to a specialist and it's maybe determined that a mobile team is needed, that crisis specialist may ask a few extra questions just to screen for if the individual has maybe been through any testing or has experienced any symptoms, so that could be communicated to our providers. Now our crisis providers and our health homes all have personal protective equipment like the masks that you see TDC wearing to be able to interact in person, and they may also maintain that physical distance as well when interacting with the individual. On our end, we've also been collaborating with our community partners wherever possible to implement telehealth crisis response. And so, for example, with Flagstaff Medical Center, we were able to introduce this method of providing crisis response services from Terros to the FMC emergency department, so that individuals who were in the emergency department could receive or continue to receive crisis services just over telehealth. And Todd, I don't know if you'd like to add anything to that, but I think we've had some great feedback from that.
We have too. I think it's a great option to not expose our staff who've seen many patients to individuals coming in, and likewise for patients that are rule out, to keep that protection. The Zoom has worked very, very well for our patients down in the emergency department. On the medical floors, we're using similar or the same technology, depending on how they would like it. Sometimes it's over the phone. Sometimes it could be via an iPad or tablet to keep that safe and keep our staff safe from going to those units, maybe where there are COVID positive patients. So all patients coming in certainly get surgical mask, and surgical masks that they can wear for their protection while they're in. Our staff are wearing them when they come in. All of our staff are checked at the doors for their temperature, any new symptoms, are given a mask, and we routinely check and monitor symptoms with all of the staff, which I'm sure everyone on the panel is doing for their teams as well, just to make sure we aren't unduly exposing those that we work with to the virus.
Brian, would you like to chime in? Go ahead, please.
Yeah, this is Brian from Terros Health again. So as far as our mobile crisis response, and I might not have mentioned this originally, but we are still providing pretty much all of our services in person, face-to-face as of this moment, other than what was just mentioned, that we're doing the telehealth in Flagstaff Medical Center emergency room. Otherwise, it's still face-to-face, but we are coming in, as Bree mentioned, knowing already whether a person is experiencing any symptoms, whether they've been in contact with someone who's been diagnosed with coronavirus, whether they've traveled outside of the country in the last 3 months, those kind of things. And depending on the answers to those questions, we might have different varying levels of personal protective equipment. So as of now, we're wearing masks now all the time. But then in higher risk situations, we might have other personal protective equipment as well. We also sanitize our vehicles many times a day, all of our workspaces. We've sort of spaced ourselves out more so that it's easier for our staff to maintain that constant 6-foot distance with each other as well. So those are just some of the precautions we're taking, but still providing that in-person response.
Thank you for that. Would anyone else like to chime in?
Yeah, I'll jump in. So we are also following a lot of the CDC guidelines and reading up on those ever-changing guidelines. But one of the more important parts is that we do check temperatures at the door. We do that at our front desks and for crisis services. We ask folks, you know, kind of where they've been, what they've been up to, if they're experiencing any symptoms, what those symptoms are, and exploring that a little bit more. And then we are providing masks to anyone that's seen in crisis, that's on our stabilization unit or in our psychiatric hospital. We've moved around some of the physical facilities a little bit so that we can have proper distance for folks. We did something similar to what FMC did with going to single occupancy rooms on our psychiatric hospital and our residential unit, so that people don't have to be, you know, within those distancing guidelines. And then we have a plethora of hand sanitizer around, and we're just constantly encouraging people to wash hands, don't touch your face, and you know, support and wave from afar rather than hugging or high-fiving. I miss high fives though, I will say.
I miss high five too. Yeah, I'll give you one. Would anyone else like to chime in on that topic? And as you're thinking, going once, going twice. My question, you know, we don't have any other questions. Folks who are watching, please do chime in. If you do have any questions, feel free to comment them and we'll take them and bring them forward to the panel. Yesterday, I had a great conversation doing one of these webinars on Facebook with Dr. Ingelthaler from TGen, who a lot of you probably know. And he's been a great resource in our community. TGen's doing some incredible things for Flagstaff and Arizona at large, but really very appreciative for their efforts. But he talked about things returning to a sense of normal, or just returning to, you know, being normal to a degree. And he said that, you know, the most vulnerable populations, we need to really do our best to protect and enhance protections around them, because they will continue to be vulnerable. And so I'm just going to throw this out to the group and see if there's any thoughts as to how we protect our most vulnerable as we continue forward through the months to come. You know, not just the next 2, 3, 4 weeks, but the next 6 months, next year, the next 2 years. How are we going to maintain that sense of, you know, safety for them? And Trevor, like you mentioned, from the Guidance Center, and Brian and all the other groups that spoke about social distancing and best practices, you know, maybe that's going to be a huge part of that solution, and maybe even applying that to all points of contact. But I just am really concerned about that population, and I don't necessarily, you know, think I have the answers for how tomorrow's going to look. Does anyone have any thoughts?
We would like to chime in on that. I think we agree with you, Adam, and we're uncertain about how tomorrow is going to look, to literally tomorrow, not just 3 months from now. So just to put that out there. But one of the partnerships that we really hold near and dear to our heart here at the Guidance Center is a partnership that we have with Flagstaff Shelter Services. And that partnership actually encompasses the Guidance Center, Southwest Behavioral Health Services, Flagstaff Shelter Services, and North Country. And it's what we call a housing as healthcare partnership. And so it's a grant funded project. And for us, it's exactly what it sounds like. And as soon as we provide someone housing, that is a piece of their health care. That program is continuing through this crisis moment. We continue to work closely with North Country, with Flagstaff Shelter Services. They have secured a location in our community where they're able to continue to house people and expand some of the social distancing within the shelter. And so we are continuing on, utilizing that resource and sticking to our belief of housing as healthcare.
Absolutely. And last Friday, the city council had a meeting, a public meeting, where we reallocated CDBG funds that we had given to the shelter services to utilize for job training. We reallocated those funds to be utilized for the investment in 2 motels, the rental of 2 motels in town, equating to about 100 rooms capacity for vulnerable populations to isolate. And, we do have Hotel Aspen, which the county has set up for folks who are unsheltered, who are either COVID positive or awaiting a result from testing. They're pending a result, so they can go there and check into Hotel Aspen. But for all the other folks in our community that just simply need to be further isolating themselves and quarantining and just having shelter at the same time, these 2 additional motels of 100 rooms, I think, will help really alleviate some of the pressures on our most vulnerable population right now, who are seeking housing support through the shelter, which is doing an incredible job given the circumstance, which is very, very difficult one. Would anyone else like to chime in on that topic of where tomorrow, what direction we're heading in, and how we can best support and protect our most vulnerable?
I'd like to add that, I think we're seeing a lot of different resources and amazing resources of that surface right now, whether that be maybe that they're more prominent on social media or in news articles, or even just word of mouth. And I think it's important to keep in mind that many of these resources and providers are available all the time, not just during this incident. And so if we can continue to encourage outreach, even if it's just letting, our close and loved ones know that those resources are available, that maybe we can make some progress on that end.
Follow-up question. You're right, Bree. There's these great resources are available all year long for the most part, and a lot of times it's just seeking that resource. Maybe someone can speak to the stigma of seeking resource and that first step that someone takes. If someone's on the fence and they just don't think that they're that person that needs that type of support, what would you say to them, and how would you encourage them to overcome the stigma?
Yeah, I think it's a big step for someone to take to start reaching out for services, and I commend anyone who takes that step to do that. One thing I would like to let everyone know is that for any individual calling into the crisis line, the individual doesn't have to give their information. They can remain anonymous when they call in. And so even if it's taking that first step and making that call to that crisis line and just remaining anonymous and just starting to talk to someone, I think is a huge step.
Absolutely. Thank you.
In addition to that, Adam, and I saw that wants to get into, but all of the people on this call here and dozens, probably hundreds of others that we work with on a daily basis, make it our mission to reduce that stigma and to tailor the services and develop the system to alleviate fear that people have of that stigma. I work personally with all of these folks here regularly on how can we do that kind of outreach and provide support for people who are scared to get services. Earlier, Trevor about some of their peer-based services, and that's a direct effort to meet that need, to help people to feel more comfortable, to come out and be vulnerable and get help.
Ron, let me follow up with you and ask you. Oh, sorry, that was the wrong mic to unmute. Let me ask you and follow up, and this is open to Bree and anyone else on the line. And Brian, we'll get to you in a minute, but talk about just the range of folks that all the agencies in our community see, and just give a couple examples of, you know, people who are on the margins of seeking help.
Everybody. You know, a complete health home, like the Guidance Center, serves everybody from birth to death, all genders, all genders, all races, all populations, the old, young, all health plans, individuals that are enrolled with the Division of Developmental Disabilities, children who are engaged with the Department of Children's Services, individuals who experience serious mental illness, children with all manner of conditions, literally the entire continuum of people with need.
I mean, the truth is, we're all humans, and it's part of the human process to struggle. You know, we make it seem like everything should be all glitter and happy, you know, especially with social media and the way we utilize technology today. It's all about the reaction from the public and your peers and being cool, you know, this whole middle school game. But in reality, we all struggle as humans, and we go through this process of life together, and it's not easy. And the struggles are kind of what make it, you know, the challenge and what's special. Although we can talk about society challenges and how government plays a role in that another time. Brian, let's give you the mic. Go for it.
Sure, yeah, and I guess I can just speak to maybe a couple of the topics that were stigma and some of the other things. I think one of the benefits of the crisis hotline and crisis services in general, as has already been mentioned, is that it is open to anyone, so any age group and any issue the person might be experiencing can call that line and, you know, talk to somebody. And maybe that is a first step, a foot in the door to just trying out, you know, I've never done this before, but let me just see what it's like to talk to someone about what I'm going through. And that can be the thing that, you know, is a snowball effect to them really realizing how beneficial that was, and now how can I get connected to more of this? And then that's, again, where the crisis services really make that connection to all of the other ongoing services and resources that are available. And then as far as reaching, you know, some maybe difficult to reach, or I think someone used the term people living in the margins. One of the nice things, again, about crisis services and mobile crisis is that we are really closely connected with a lot of agencies around town, including Flagstaff Police will call and request mobile crisis teams to come out. So people that maybe normally aren't going to, at least at first, walk through the door of a healthcare provider might have somebody else that helps them get connected and helps them take that first step toward more connection and more support.
Thank you for that, Brian. And that's such an important point, that it can be hard to make that first call and recognize the importance and the resource that is available to you. But once someone does take that first step or that leap into the pool, you learn to swim really fast, and you actually learn to really appreciate what you're receiving, because it enhances you and enhances your life and your reality and your ability to show up in your day-to-day life, you know, and be the best you can be and bring the best version of yourself forward. Eric Nolan's tuning in, and he asks, what resources do you need in the coming months? I could use some TP at my house in a little bit here. I'm getting close, but what about you all? What resources do your agencies need in the coming months from the public?
So I would like to speak to that a little bit on behalf of the Guidance Center. For us, one of the things that we are really talking about is spreading kindness. And I think we've all alluded to this, that it's a stressful time. And as an employer, there are a tremendous amount of changes going on with our employees as well. New policy, new this, new way we're doing business every day. And so for us, spreading kindness, being patient, and being supportive are some of the best resources and supportive acts that we can see from everyone in the community.
And if I can add one quick thing, thermometers are the new toilet paper.
Oh yeah.
So good luck finding one anywhere out there, and we're always looking for more. And cameras for Zoom.
Oh yeah, that too.
Yeah, I fortunately got my whole setup before this whole thing went down, so I got all my gear, and I've seen the prices go up quite a bit on the gear I got. Who else would like to chime in on resources you need?
I think we need this is Kim. I think we need the community's help in checking on their neighbors and things like that, and bringing forward people that they are concerned about, because I think the ones that we know of, we can check on and we can do that type of thing, but there are a lot of other people that are struggling and we are not aware of them, and we would like to, be able to help them. And so, checking on people around you. And I think somebody kind of said earlier, if you're going to check on them once, check on them 3 times, anything that we can do together as a community. And I love what Lauren says. I mean, spread kindness. It's times like this that can bring us together, or it can, create more division. And I think we have a wonderful community that tends to pull together and do a good job. So any help that anybody from the community can give us in terms of that, we would greatly appreciate.
Terry, would you like to chime in?
Sure. So I just want to encourage self-care for any youth, not only youth, but any adults. I know with the school closing, any sports canceled, a lot going on and changing. I just want to encourage that, self-care is really crucial for everybody. So making sure that, you're either indulging in your hobbies or finding new hobbies, and checking in on your friends. Social distancing doesn't mean that you can't FaceTime friends. And I know for myself as a therapist, I'm going to be providing mental health kits for my clients. And a mental health kit is kind of just like a self-care package, which includes like therapeutic putty, the sniff and scratch cedar, therapeutic bear. So I just really want to encourage any kind of self-care to anybody out there.
That's great. And thank you, Terry and Kim, for those comments specifically, because I think that, a challenge I put out to everybody and all of you is, we're seeing a lot of folks in our day-to-day lives who are projecting stress, anxiety, anger, frustration, fear through their words, through their communication with us. And even in our, workplaces amongst leaders, I'm seeing it, and I'm sure everybody else is seeing it, because it's human nature to not take that time to really take care of yourself and center yourself and breathe into yourself and do what it is that you need to do to sleep well and to eat well and to be well, so that you can bring your best self forward. So, for anyone who is trying to have more awareness and consciousness, also keep in mind when people interact with you that a lot of times they're projecting, and not to take it personally, and to really distinguish that from, you, especially during this reality, because people who are close to you, sometimes your best friends or your family members, might snap at you, and it's not to be taken personally, in my personal opinion. It's really just, a testament to the times we're in. And so I just wanted to share that. We're running close to the end of our time, so I'd love to kind of go back through the panel and have each of you just share a couple closing comments, and we're going to reverse the order. So we're going to actually start with the Guidance Center and then move up to NACA and Terros.
All right, well, Adam, again, thank you for putting this together. It's really, I don't know how many times it takes to hear about resources before people finally feel okay accessing them. I personally need to hear about something about 7 times. So I appreciate you putting something like this together on top of having your website, on top of helping get the word out about different services and different resources, because we can't spread that information around enough, I don't think. And so part of what helps fight the stigma also is just getting the word out on different things, being aware, and the more people are talking about resources, the more willing other people are going to be to access them. So we want to be part of this community. We're proud to be partners with a lot of the folks on this screen right now, because it really takes every single one of us, plus hundreds more, to do what we do, and it still doesn't always feel like enough. And so we just want to be here for the community in whatever way we possibly can, and know that we really appreciate all of the support from city, county, and all kinds of other partners, because it really does. We all have to come together to help.
Thank you, Trevor. Lauren, any words of wisdom in closing? A favorite quote?
Oh, my favorite quote. Well, it's a little bit of what you said, is be your best self. That's it. Work to be your best self. That's what I tell my kids. That's what I tell my husband when I leave the house. Be your best selves. Even when you're home, all together.
And as far as any closing comments, thank you, Adam, again, for bringing us all together. I guess in my native language, Nahung Vita in Hopi, that means be strong, in Navajo Yego. I just, pray, continue to support one another, and continue to be there for one another, and we will get through this.
Thank you, Terry. Brian, Terros.
Yeah, I think just in closing, I just want to emphasize, and I've really seen this in the communities of Northern Arizona, including Flagstaff, is just we're all together. So, as providers, but even just as people, residents here, we're all, all of our experiences are unique and different, and yet as a society, as a community, we're in this together, and we just need to remember that, and remember that none of us are alone, and that help and support is out there.
Beautiful. Thank you, Brian. Bree and Ryan with healthcare. Health Choice.
Yeah, so I would just encourage everyone again to reach out for services if you are in need. And if you reach out to anyone on this group or any of the providers in the community, I can guarantee if it's not the right fit for you, or you have other needs, that individual will make sure you're connected to the right resource. And if someone isn't comfortable, leaving their house or reaching out to one of these providers, to call the crisis hotline and just make that phone call and talk to someone, even if it's anonymously.
And I'll mostly close as I opened by saying thank you to all the people on this panel, to all healthcare workers, behavioral healthcare workers, law enforcement, first responders, and everybody that is doing this hard work to keep the population healthy in very trying times. So thank you to all that, and reaffirm what Lauren said, spread kindness.
Thank you. Northern Arizona Health with Todd and Kim.
Yeah, I think going off of what Lauren said, being your best self, being kind, with people being closer to their families, being isolated, distancing, all of those things, it's very easy to take it out on your loved ones when the reality is you're just mad at things you can't control, which is this awful thing called COVID, which is global, right? And the stress levels, it's easier sometimes, unfortunately, when you get irritable and you take it out on those that you love because they're right there and they're listening to you. And the reality is maybe taking a step back and seeking out those mental health services if you need it, even if you've never had them before, calling a hotline, calling to talk to someone, because it's tough. Kids are not in school, kids are bored, kids are supposed to be doing their homework, and getting them to do that, you're homeschooling when you didn't sign up for that. And all the daily stressors that we normally have are compounded by all these other factors that we can't control. And be kind to those around you, be kind to yourself, and seek the help that we've talked about today, because we are here, we're available, and we definitely want to help and support our community.
And I would just add again, thank you to everyone, but then for anybody on the line and for any provider that's, with us today, just to say that you're not alone. None of us are alone. We are all in this together, and we will get through it. I don't know how, but I know that we will, and we'll do that together. So just, we've got a wonderful community and great people wanting to help. So let us help you, please.
Beautiful. Thank you. Thank you all so much for joining this panel, for your work in our community, and for what you do, and for waking up in the morning and getting out there and helping and giving back the way that you do. I want to invite everybody watching from home to visit the flagstaffresources.com and onlineteenhelp.com websites. They're great resources to navigate all the different programs we're talking about today, plus many, many more, from things from the county about rental assistance and mortgage assistance, utility assistance, care programs and meal support agencies and efforts. I mean, there's a whole bunch of great things happening in Flagstaff right now to support you. So definitely check out those websites and visit all these great panelists programs and their websites, and definitely seek the resources that you need to better yourself, to better everything around you. That's really what we need everyone to do, is just be the best that they can through these most difficult times. In closing, I'd love for us to just kind of close with a moment of silence for all those who are struggling today in our community, across the state, the nation, and the globe with this pandemic, with everything and anything that they are struggling with. There's a lot of people who are not, thriving today, and I just want to recognize them. So just, if you wouldn't mind joining me in a moment of silence. To it, happiness and positivity, because that's what these people really need right now, is that kind of mental and emotional and physical support. Thank you so much. Take care of each other, and we will continue doing these webinars for you, including one tomorrow. So stay posted on our Facebook page. And again, thank you to all the panelists and everyone watching. Have a wonderful day.